Hello everybody and welcome to the Tuesday edition of Video Clips, and just a couple of quick announcements. First of all, those of you who want to talk about careers, keep those emails coming. I'm having some great conversations with people every week about what they can do regardless of their training or lack thereof or what your background is. I think to fix healthcare in this country, we need all hands on deck, and there's a place for everybody. So send me an email if you want to talk about it, pampopper@msn.com. Also, many people taking advantage of the free trial membership get a little taste of our content. We're so confident in how great our stuff is. We know that you'll want to do more as soon as you sample it. So pampopper@msn.com. And last but not least, in July, I'm going to teach a 4-class series on inflammatory bowel disease. I've been researching this for 18 years. I've accumulated an enormous amount of data, and it's everything from the risk factors for the condition, contributing causes, to the drugs and the procedures that are used, to the diet and lifestyle interventions that have shown some efficacy. And so if you or somebody you know suffers from this dreadful disease like Crohn's or colitis, or if you're just a health professional who wants to know more about it, or a concerned individual who wants to know more, the course will start toward the latter part of July and run for 4 weeks. So just giving everybody a heads up that that's what we'll be doing next that's new and interesting. So I chose a topic for today that I've been wanting to look into for a long time and finally had enough time to research it. And it's a little bit outside my wheelhouse, which is eye health. But having said that, I'm pretty good at evaluating medical information. So here goes. Lasik surgery was approved by the FDA in the 1990s, and since then, about 9.5 million Americans have had the procedure to correct their vision. And one of the major selling points is that you can stop wearing glasses or contact lenses. Lasik stands for Laser-Assisted In Situ Keratomylosis. That's a mouthful. We're going to call it LASIK from here on out. The procedure is performed using an ultraviolet laser to reduce the curvature of the cornea for people who are nearsighted. And if you happen to be farsighted, then the curvature is accentuated instead. The procedure takes about 15 minutes per eye. It's usually not covered by insurance because it's considered an elective procedure. Most people, about 95%, are happy with the results, but there are side effects which range from worsening vision to severe pain and dry eye that are often not disclosed prior to the procedure. So it's another one of these full disclosure type of things that's just not going on like it should. In 2017, just last year, the FDA conducted an analysis which included 574 people who had had LASIK surgery, and it showed that the incidence of side effects may actually be much higher than what has been previously reported, with 43% of patients reporting new visual symptoms following the surgery. The lead author of this particular research effort and the article that covered it was Dr. Malvina Eidelman, and she is with the FDA's Center for Devices and Radiologic Health. The data were gathered using questionnaires, and one of the first things that caught the researchers' eyes was that the incidence of symptoms that was disclosed through the gathering of information by questionnaire was a lot higher than the number of symptoms that were reported to health professionals at the clinic where the people had the procedures done. The researchers wrote that somehow people feel reluctant to report negative effects to the health providers, which has resulted in a significant underestimation of the risk of events. So here is what the FDA analysis showed. 3 months following surgery, between 50 and 60% of patients reported glare, halos, and double vision. 5% of the patients described these symptoms as being extremely bothersome. 6 months later, 41% of the patients continued to report visual disturbances, with almost 2% reporting that their issues were so severe that they were no longer able to do some of the things that they would normally be doing. Also at 6 months, 25% of patients reported mild to severe dry eye. By far, the most commonly reported symptom is dry eye by patients who have LASIK surgery. One study reported that almost half of patients report it following the procedure. One thing that's interesting, and this goes to the type of disclosures that should be made, is that the incidence of dry eye, there are risk factors for it, that some patients could identify themselves as being at risk and may have a different decision, make a different decision about the surgery. So those who are at the highest risk are those who have more severe nearsightedness prior to the surgery, and the depth of the laser surgery required, which goes to how severe the myopia is. For many patients, dry eye is transient. It resolves on its own, but it can take up to a year and in many cases even longer to resolve. It's a very uncomfortable position, and artificial tears are usually prescribed to resolve it or to alleviate the discomfort. In one follow-up study, glare from oncoming car headlights was reported in 58.4% of patients, and 52.8% of those patients reported that it was more bothersome to them after versus before they had the procedure. Night driving was reported to be more difficult after surgery by 39.4%, but to be fair, 59.3% reported that they actually found it easier to drive at night than they did prior to having the surgery. Other side effects can include permanent injury to the eye, and one of the reasons is that sometimes the nerves of the cornea are severed, and another issue is the loss of the ability to discern different shades of color. Even those who perform the surgery acknowledge that there are some concerning side effects. One study in which the lead author was the medical director for an international laser eye surgery provider found that 10.2% of patients reported difficulties with outdoor activities and reading, 20% had pain or what they described as sore eyes, 40% were sensitive to light, and 33% had difficulty driving at night. Additional complications include an increased risk of earlier cataract surgery and also a rare condition called corneal ectasia. It's a progressive condition that involves a thinning of the cornea and progressive myopia, often associated with astigmatism as well. This can take place as early as a week after the procedure, but it often can happen several years later as well. And one of the problems with the research that led up to the approval is, as with so many things, the FDA approves based on very short-term follow-up, and long-term follow-up is after everybody starts doing whatever it is that's being evaluated and the reports come in. Patients at higher risk of this vision-threatening condition are those who have higher corneal thickness, worse myopia, keratoconus, which is an abnormal shape of the cornea, and low residual stromal bed thickness. Treatment for mild cases includes going back to wearing glasses or certain types of particular contact lenses, and for more severe cases, surgical follow-up is required. Interestingly enough, an effort to convince the FDA to issue better warnings about the side effects of Lasik is led by a retired FDA employee who played a role in the procedure's approval. His name is Dr. Morris Waxler. He thinks the FDA should tell the public that there are significant and persistent side effects and issues with Lasik that often don't go away, and that people who choose to wear glasses or contact lenses don't have exposure to these types of risks. Waxler has tried petitioning the FDA to withdraw approval of the procedure on the basis that the manufacturers of the lasers that are used underreported or misclassified adverse events during the clinical trials. Waxler I think, is probably right about this, because it is a well-known problem that the people who submit data from the companies that make devices and drugs often misreport or misclassify adverse events. Of course, advocates defend Lasik, and they rightly state that the risks are low and satisfaction is fairly high for people who have the procedure. Others, include some ophthalmologists, say that people should be more informed before consenting to the procedure, and this is particularly the case because it's an elective procedure. It's not necessary, and what you're basically doing is operating on healthy eyes, and that's something people should probably think just a little bit more about. At the very least, I think that people who have higher risk factors for things to go wrong should really carefully evaluate and ask themselves if they want to do this. And we know who those people are. The high-risk patients include those who have large pupils, abnormally thin or thick corneas, abnormally shaped corneas or corneal abnormalities, severe astigmatism, severe dry eye, pain or neurological disorders, frequent headaches, and anxiety or depression. So people who fit any one or more of those categories should probably think a little bit more about whether or not they want to have the procedure, but as is the case with so much in medicine, that's really not done, and most people just kind of blindly go into it and then find out later that things go wrong. So again, patients should always evaluate the pros and cons of any procedure, but I think the bar has to be set higher when you're operating on a healthy body part and it's an elective procedure versus when you're in the emergency room and somebody's trying to save your life. I mean, there's absolutely no reason for the risks not to be reviewed before going forward. There's plenty of time to do it, right? So I'm not trying to dissuade somebody from having LASIK surgery. As always, the decision is up to you, but we just want you to have a full not full knowledge of the facts so you can make a good choice. All right, that's all for today. As usual, pass this on to anybody who you think might enjoy watching it. I'll be back to you Thursday with more news.